This computer. Good afternoon. On behalf of the team at Regina District Industry Education Council, I would like to welcome Dina Karner. She is here this afternoon to discuss her occupation, which is physical therapy, what she does, her education, her background, career opportunities, salary expectations, working conditions, and various therapies she uses in her practice. Just a reminder before we begin that after this presentation, please complete the survey found on our website by using either the QR code or go directly to our website at www.rdiec.ca. And by completing this survey, you are automatically entered to win a $50 gift certificate, which will be drawn at the end of each month. Thank you again to Dina Karner for this informative presentation to help our students in their quest to make better choices about their future employment opportunities. I'll turn it over to you, Dina.
Okay, great. Well, thanks for having me. As Gord said, my name is Dina Karner. I am a physiotherapist at a private practice in Regina called Brownstone Health. That's where I am right now. I'm in my treatment room. Yeah, and so I just thought I'd talk a little bit about my profession and just like Gord said, different aspects of it and how I got there and how you can get there too if you're interested. So I'll just share my screen here with my PowerPoint. Everyone can see my PowerPoint there? Good. So as I said, I'm a physiotherapist. My credentials there are all those letters behind my name. The first one means Master of Science of Physical Therapy. I also have a Bachelor of Kinesiology, and I have a transitional doctorate in physical therapy as well. And like I said, I'm a physio at Brownstone Health in Regina. So I thought I'd start with what is physiotherapy or physical therapy. So those two terms are actually interchangeable. Particularly in Canada, someone might call you a physical therapist and someone might call you a physio. So I have a few quotes here from the Saskatchewan Physiotherapy Association page, and I'll kind of go over what they mean. So physiotherapy is a healthcare profession which assists people to, I'm just gonna move this here out of the way, to restore, maintain, and maximize their strength, function, movement, and overall well-being. So what does that mean? So yeah, we're a healthcare profession. You can find us in hospitals as well as clinics. We like to generalize our profession because it's very wide reaching in terms of where we work and the settings we work in. We like to generalize it as that we are restoring people's function. So I think a lot of people are mostly familiar with physiotherapists in a private clinic, like where I work, where you hurt your knee and then you go and you see a physio and they help you get back to your running or your sports or just have less pain or whatever it is that you need to do. And so that's sort of what people think of when they think of physiotherapy. But there's lots of other different settings and different where function might need to be restored for a person. And so the physiotherapist, like in the hospital or in rehabilitation centers. And so that's where physiotherapists come into that. And next quote there, physiotherapists have an in-depth knowledge of how the body works and specialized hands-on clinical skills to assess, diagnose, and treat symptoms of illness, injury, and disability. So if you've been to a physio, you probably know that physio asked you a bunch of questions. He maybe even told you and then put their hands on you and moved you around and to do different tests on you. And then maybe gave you some sort of diagnosis, like what they find is going on with your injury, and then used their hands again and other equipment and modalities to treat the symptoms that you're having due to that injury. And the last one there, physiotherapy includes rehabilitation as well as prevention of injury and promotion of health and fitness. So rehabilitation, again, in that very familiar setting in a clinic, you have an injury, you go and you have rehabilitation for it. But there are lots of physios who work in, for example, sport or with seniors who are more in the prehabilitation setting. Meaning prevention and just trying to keep people moving and try and maintain people's function. So that's kind of what those three quotes mean if you ever stumble across the Saskatchewan Physiotherapy Association website. So in what areas do physiotherapists work? So when I say areas, I mean different body systems, I suppose. So orthopedics, again, in private clinics, you injure your knee, you go see a physio, and you will have an assessment and treatment, and they restore your knee function and reduce your pain and restore your strength and whatever else. So orthopedics includes pretty much any type of injury you think you could sustain. You might go see a physio for that in a private clinic, particularly. But physiotherapists also work in neurology. So there are certain injuries such as acquired brain injuries, or if someone has had a stroke or a spinal cord injury, you would work with a physiotherapist afterwards in order to restore your function due to that type of injury. So this is where you might see a physiotherapist in a hospital or in a rehabilitation clinic, or also in a private clinic as well. Cardiorespiratory. So when people get quite ill and they have problems breathing, or they're in an intensive care unit in the hospital and they develop a pneumonia or some other type of lung issue, you may see a physiotherapist in those settings as well. So like I said, in an ICU, you might have a physiotherapist who uses manual techniques to get you breathing better, depending on what's wrong with you. Or you might see a physio in that setting also to get you up walking again if you've been very sick and bedridden for a while. Cardiorespiratory also means it could be a setting such as like a clinic or a rehabilitation center where people might go after they've had a severe heart attack or heart surgery for rehabilitation to restore their cardiovascular conditioning. So physios are also involved in that. Pediatrics, the fancy word for children. So again, children can go to private clinics if they've had injuries, like sports injuries or things like that. But there are also physiotherapists that work in rehabilitation centers and in schools and other settings like that, where with children who may have a special condition like Down syndrome or cerebral palsy. Vestibular rehabilitation. So some people have different forms of dizziness, lightheadedness, or vertigo, and there are specially trained physiotherapists out there, again, largely in private clinics, who can help people get rid of their dizziness and get back to their function in life. It's very difficult to be dizzy all the time and function properly. Pelvic floor. So there are physiotherapists such as myself who have specialized training in working with people who have pelvis issues. So you may have pain there, or maybe women who've just had babies, or people who've had pelvic surgeries. There are physiotherapists that have specialized postgraduate training in order to help people with those types of issues. And you can find those physios generally in private clinics, but there are some publicly funded pelvic floor physios as well. Oncology. So when people have cancer, they may have, depending on the treatment that they've received, they may have restrictions in their movement afterwards, or they may have problems with lymphedema, which is when a limb swells due to lymph nodes being removed or injured to lymph nodes. And so there are physiotherapists who are specially trained in order to work with people who may have some of those types of issues that go along with cancer treatment. Rheumatology, so the fancy word for any sort of arthritic condition, I suppose, or systemic condition. So people who have severe osteoarthritis, or maybe they have rheumatoid arthritis. They might see a physio for protection of their joints and strengthening and mobility in order to make sure their joints can stay as mobile and the muscles around the joints can stay as strong as possible for as long as possible. So sports, so this is kind of the most popular option when people are thinking they want to go into physio. They say, I want to be a sports physio. So there are some physios who work entirely in sports. They work for professional sports teams or for the Canadian Olympic Committee. or they work part-time on sports teams and part-time somewhere else. And so they have specialized training in how to deal with fresh acute injuries and sort of that almost that first responder training as well. So seniors. So seniors can be seen in all of the settings that I've spoken about already. There are some settings too where seniors may have sort of a rehabilitation exercise class that physios might lead, or also there's just specialized considerations when working with seniors, as they tend to have some other types of conditions like high blood pressure, other things that need special consideration when they're seeing a physio and when they're rehabilitating an injury. Some physiotherapists go on to be managers in hospitals or public healthcare settings. Some physios go on to become clinic owners, and so some physios go on to become policy makers or policy developers as well. So if that was a career progression that you were thinking of, then you might end up getting into more of an administrative role rather than a clinician role. And some physiotherapists also go on to do research, because research is always evolving, and we need more research all the time. And so some physiotherapists might want to go back to school to get a PhD and become a researcher, or assist with research and data collection. So there are some physios who do that as well. So where do physiotherapists work? Well, based on all of those different areas that a physiotherapist might work in, you might see a physio in a private clinic, like I've already mentioned before, in hospitals or acute care. You'll see physiotherapists working in long-term care homes, again, with seniors, trying to keep them as mobile and walking and as strong as possible for as long as possible. In schools, again, working with children. In rehabilitation centers and hospitals. So the example of that in Regina is the Wascana Rehabilitation Center. There are many physios working there in many different facets. Home care, a physio might go into a person's home, and if they're unable to leave their home after a surgery or with an injury, there are specialized physiotherapists who do that. Again, you might see a physiotherapist working at a sports clinic or facility, or working events. So Saskatchewan Summer Games, Winter Games are coming next year or in 2023, I believe, to Regina. So there'll be definitely some physiotherapists working at that event to keep everybody moving. Public health facilities. So there are some different sort of centers in Regina where you might see a physiotherapist who will assess you and decide if you need to see a surgeon, or what the next plan will be for you, sort of as a triage, or deciding what the next best move is for you. So there's a few clinics like that in Regina that don't fall into those other categories. And you might also see a physiotherapist working in a workplace, in industry. So sort of helping assess proper movement, proper lifting technique, proper like ergonomics, maybe the chairs that people sit in, or the tools that they use. Physiotherapists can help workplaces determine what's safe and how to keep people safe. So tools physiotherapists may use are hands. So again, if you've been to a physio, likely you saw one in a clinic, and they use their hands to move you around and to maybe mobilize muscles or joints and get things moving and feeling better. And so definitely using our hands is a major, use your hands a lot in this profession. But also our knowledge. So especially these days, you can Google just about anything. So knowledge is a really big tool. Some people have experienced misinformation. And so sometimes a major part of intervention for a patient might be just to make sure they have the correct information and know what to do to help themselves. So we use lots of exercise equipment. We use stretchy bands, weights, foam rollers, balls, Bosu balls, all sorts of fancy equipment. yeah, we usually tend to have gyms attached to our clinics too, so that a person can be taken into the gym and shown exercises in there with equipment. And we can provide some of that to our patients usually as well. Functional equipment. So in the case of a physiotherapist who might work with a injured worker, for example, or with anybody who's had any major injuries and they're unable to get back, they're unable to do the chores they need to do around the house or get back to work or anything like that. There's also equipment in order to sort of simulate real life and to train with in order to get back to that function. Functional equipment can also include something that we call gait aids, which is like a walker, if you've ever seen someone walking with a walker, or a cane, or any other types of equipment that help that person to be able to walk. So we work with that as well. The other thing I'll say too about functional equipment is maybe that includes braces as well. So if you've ever gone to a physio and they recommended a specific brace for your knee or your ankle, we also fit people for those quite often. So computer programs, we're not spending a lot of time on our computer. Well, hopefully we're not. We do have to do charting. We chart on every patient that we see every time we see them. And often we have reports to do to different insurance companies. So we do all that on a computer. Scheduling, there's also scheduling programs that we work with. And some people work with computerized exercise programs as well in order to sort of put together an exercise program that they might send home with a physio or with a patient. And then some of the other tools, manual tools that a physiotherapist might use. Some physios have specialized education in acupuncture or in dry needling, which is a form of needling for the muscle. So if you've gone to a physio and they used acupuncture needles on you, that could have been one of the techniques that they were using. And then modalities is a word that sort of encompasses different things like ultrasound, IFC, muscle stim, so any sort of electronic devices that help getting muscles moving, help with pain relief, help with inflammation. You might have gone to a physio and maybe they used one of those tools on you as well. Okay, so education requirements. So physiotherapy is a university. You have to go to university to be a physiotherapist. The entry-level education in Canada, which means the minimum, the degree you must obtain in order to be able to work as a physiotherapist, is a master's degree. So that means you have to have a 4-year bachelor's degree first, and then you would apply, or you're getting that, you're achieving that, you're in your last year of getting that degree, and then you apply to a physiotherapy program, and that physiotherapy program is a master's degree. There are 15 physiotherapy schools in Canada. 10 of them are English speaking, 5 of them are French speaking. Other countries only have bachelor's degrees as their entry level. The US, you actually have to get a doctorate in order to work there. That's the only country in the world where physiotherapy is a doctorate degree and is a requirement as well. 15 universities offer physio in Canada, as I said before. So in Saskatchewan, our provincial physio school is at the University of Saskatchewan in Saskatoon. It is housed in the College of Medicine and in the School of Rehabilitation Science, which encompasses physiotherapy and also occupational therapy. I went to the University of Regina for my bachelor's degree, and then I went to the University of Alberta, actually, for my physiotherapy degree. And we were also in a school of rehabilitation medicine with occupational therapists and speech pathologists too. So that's becoming more common across the country. Entry requirements. So for the University of Saskatchewan, you must be a Saskatchewan resident. So you have to be able to prove that you are a Saskatchewan resident. If you grew up in Alberta, for example, but then you did your bachelor's degree in Saskatchewan, you would meet those residency requirements. So you have to prove that you're from Saskatchewan. There are other schools, like for example, the University of Alberta has 80 spots in their school every year, and they designate 15 of them for out-of-province students, and the other 65 are specifically for Alberta residents. University of Saskatchewan has 50 students, I believe. And like I said, they must all be Saskatchewan, or I should say, sorry, Yukon, Northwest Territories, or Nunavut residents. And 6 of those spots are also reserved in Saskatchewan for Aboriginal students as well. So that's the residency. Courses, at the University of Saskatchewan right now, you have to have 6 credits of human anatomy, 6 credits of human physiology, and 6 credits of statistics. Otherwise, you could get a political science degree. It doesn't matter what degree you have, as long as you have those courses, then you can apply to physiotherapy. Depending on the school you want to apply to, the requirement is different, and so you just have to check with that university as to what courses they want you to have. Generally, they don't really care what bachelor's degree you do, as long as you fulfill their course requirements. And then language proficiency, English, if you're applying to an English university, and if English is not your first language, then you have to provide language tests that show that you have proficiency in English in order to attend a school like that. So currently, and I'm unsure, I asked some people here, currently, the other entry requirement, part of the application process, is to go through this CASPER test. So it is an online exam, and it consists, it's similar to when people think of an MCAT or an LSAT for law school. It's sort of a skills testing test, your ability to reason and to use logic and things like that. So this is being completed online and is a requirement of part of the application to the University of Saskatchewan. And then there's also an option there where you have to write a personal statement. So sort of some words about why you want to be a physiotherapist. Requirements are different at other universities and maybe also different in other times. So some universities have in-person interviews where you might go through some different stations, and you're interviewed by different people, or you might be put in a role-playing scenario where you have to, let's say, for example, I had to help someone up who had been walking with a walker and had fallen and didn't speak English. And so I had to go into the room and I had to assist that person getting up off of the ground, and I couldn't use language to communicate with them. So there might be it might be sort of an in-person interview like that. And then also some universities require volunteer hours in a relevant sort of healthcare type of setting as well. So it's changing all the time. The U of S used to do an in-person interview, sort of a 10-station interview. And now they're doing this. I'm not sure if it's because of the pandemic or if they just changed, but they seem to change their requirements all the time. So yeah, just as long as you look up every university and know what they need that year, then you can figure that out that way. So there's also a minimum, so you need specific courses in order to be able to apply to physio school, but you also need a minimum average. So the minimum average is required in order to even be able to apply to the U of S is 75%. That does not guarantee that you'll get in though. And as you can see by this chart here that I took from the University of Saskatchewan's Physio School's website, in 2020, there were 216 applicants, and the minimum admission grade point average was 83, and the mean average of the class was 89 getting into school. But you can see though, in 2015, the lowest grade that was admitted to physio school was 79. So it really varies from year to year. I know a lot of people who are applying to medical school might also apply to physio school in case they don't get into medical school. And then some years that might be a lot of people, and some years it might be not very many. And so that really determines how many people will apply and how many people will actually accept a spot in the physio school, depending on if they got into another education that they were hoping to get into. So just some numbers there to give you an idea. Okay. So education requirements continued. So So you'll go to a master's degree if you get into physiotherapy, and it varies a little bit in length. Most masters, the U of S is 2 years and 6 weeks, and there are some that are 2 years and 3 months. So it's not really that big of a difference across schools. Physiotherapy schools generally go for that whole duration, except for maybe they have August off. So it's generally a full year program. I know that changes lots too. The U of A tried a year where they didn't take August off in order to end earlier, and then they went back to how they were doing it before. So that all changes all the time. And so then you graduate from your master's degree with your physiotherapy degree. And then you have, in order to be able to practice, you have 2 licensing exams. They're called the Physiotherapy Competency Exam, PCE. So there's a written exam that you have to pass, and you can actually write that while you're still in school. And once you've passed that exam, then you are allowed to do the practical exam, which they only offer twice a year. And so with a written exam, you can practice as a restricted physiotherapist. And then once you've passed the practical exam, then you are a fully licensed physiotherapist. And they're pretty expensive. When I went through those exams in 2009 and 2010, the written was $600 and the practical was $1,200. And if you fail the exam, you can write it again. We just have to wait until it comes around again, and then you have to pay for it again. So I'm sure it costs a little more now than it did back then, but yes, and then once you pass those exams, you are licensed to work anywhere in Canada. After that, it's proof that you attained that standard that is required of all of Canada in order to work there. So, and then once you're a physio, fully licensed physio, passed your exams and everything, you're still going to be a lifetime learner, because that's what physios are. As I said before, there's the science and the research is always evolving and changing. And so if you want to do a good job and you want to be good at your job, then it's good to continue to go to upgrading courses and continue your learning. Some provinces, so you get a license with your provincial college. I'll talk a little bit more about that in a bit. But some provincial colleges, in order to renew your license every year, it is required that you show proof that you've been doing some continuing education courses. In Saskatchewan, that'll be required next year. So there's an option this year in order to put on there what you've done for continuing education, but it's not required until we renew our licenses next year. And then that is often on your own doing to pick those courses and pay for them. And then some people go and get courses that give them special designations or degrees. So I've got a couple examples there. FCAMPT is a specialization that people might go to in order to be able to do manipulative therapy, which is making people's joints crack, and just generally knowing more about manual therapy, and then they can put that FCAMPT behind their name. Gun IMS, that is a form of that dry needling I mentioned before. And again, someone might go and get that certification and they're able to put that on their business cards, for example. Or DPT, so it's a doctorate in physical therapy. Again, you have to acquire that through the United States because that's the only place that they offer it, but there are options to do that as well. But there's also much less, there's like all sorts of courses that are smaller and bigger and is just one weekend or take several years. And it just depends once you become a physio, what it is that you're looking to get more education in. Okay, job prospects. So we are very employable. One of the reasons I myself got into physiotherapy was that you'll pretty much have a job anywhere you want to work. All over the world, and Canada has the luxury of having relatively highly educated physios. So if you were to go and wanted to work in Europe or in Australia or somewhere else, generally our education is entirely transferable. So that's nice to be educated in Canada for that way. And yeah, there's sort of a whole bunch of different job boards you can find. You can look, our professional associations send us emails, job boards. You can sign up for different, like LinkedIn and things that I'm too old to, to be signed up for myself, where you can find jobs. There's always physiotherapy jobs all over the place. And some private clinics are even looking for a physio, even though they maybe haven't officially posted it anywhere. So after you've graduated, it's always worth it to send out a resume to a bunch of clinics, because some of them might be on the look for a physiotherapist anyways. So lots of job opportunities out there. Salary. So in the public system, so meaning working in a hospital or a rehabilitation clinic or a school or a long-term care center, anything that is government funded, that's working in the public system. So a new grad in Saskatchewan would start out at $36.59 an hour. And get up to, there's steps, you get a raise every year of experience you have, you go up steps, and then that's also renegotiated by the union against inflation as well, and to sort of a maximum of $56.49. But a lot of physios do end up going on eventually into some sort of senior management role, and then of course there's more potential for earnings there as well. Another benefit of working in the public system is that includes you get group benefits included, sick and family leave that's paid vacation, employer contributions to RSP, top up during maternity leave, and things like that. So there's a lot of benefits that publicly funded physiotherapists enjoy. And then in the private sector, it's kind of variable. It depends where you work. Some private clinics employ their physiotherapists with an hourly wage. And some private clinics have contractors, independent contractors, where you sort of rent a room, and the money that's paid per patient is paid to the physiotherapist, and then the physiotherapist just pays rent to the owner. So it's really variable. And then some people, it depends how much you work. Some physios don't work full time. But it is definitely possible for a physiotherapist to make over $100,000 a year. But again, how much over that just depends on the clinic you work in, and it actually varies quite a bit how much that clinic charges for their appointments, and it varies quite substantially across the country as well. And then a lot of times too, especially in the case of an independent contractor, they won't have benefits, they won't have paid vacation, they won't have those things. So you might get paid more to do that, but you have to take into account you won't have paid vacation. You'll just not make money when you go on vacation, and you'll have to buy your own private benefits or things like that, and have your own savings plan as well. So there's pros and cons for both systems. Okay, relevant professional associations. So I talked about the college. So every province has a college. Ours is the Saskatchewan College of Physical Therapists. That is the regulatory organization. So they are the ones that protect the public from us. So they ensure that we are fully licensed and we have all the skills we need, and that we are being safe, and we are working within our scope of practice, meaning we're not pretending to advise on medication or things that physiotherapists are not allowed to do. And so that's the college, and that is also the licensing board. So where we get our licenses every year, we renew them through the college. So then the Canadian Physiotherapy Association, and then the Saskatchewan wing of that, the Saskatchewan Physiotherapy Association, that's the professional association. They are a group that advocates physiotherapy to the public. So they help us get the word out about physiotherapists, what we do. They help make sure that we are getting paid what we're supposed to be getting paid. They provide education, not just for physiotherapists, but for the public. They help us get job advertisements out there, and recruitment and retainment. And yeah, they sort of work for the physiotherapist in helping them with advancing their career. And then unions. So if you work in the public system, in most cases, you will be, especially in Saskatchewan, you will be under the Health Sciences Association of Saskatchewan. So that's a union that incorporates occupational therapy, dietitians, speech pathology, and a bunch of those types of healthcare professions. And so they would work for the physiotherapists in order to negotiate salary and benefits and rights and all of those things in the public system in Saskatchewan. Okay, my background. So, why did I want to be a physio? Well, to be honest, I had cousins that were like 10 years older than me. I grew up in a small town. They went on to be physios, and I was like, yeah, I like sports and I like moving and not sitting at a desk all day. So that sounds good. And so I just I kind of stuck with it, stuck with that idea. And I remember too, I watched a movie. It's an older one. I think it's called Regarding Henry. And a man there has a brain injury, and in part of the movie is he goes to rehabilitation, and his physio gets him walking again. He thought he would never walk again. And I remember watching that as a young person and thinking, wow, that would be a super cool job. So yeah, that's kind of how I decided I wanted to get into physio. My education, so I grew up in Rollo, if anyone's familiar with Rollo, Saskatchewan. And like I said, I went to the University of Regina. I played hockey there, and I attained my courses in order to be able to apply to either the University of Alberta or University of Saskatchewan, just to keep my options open. But I got my bachelor's degree in kinesiology at the University of Regina, and then I applied to both U of S and U of A, and I chose U of A. And I went there and I did my 2 and 3 months master's degree there. And then I got my first job in Lloydminster. My husband is also a physio from Europe, so that was where he got his first job. So I joined him there. And then after we had our first baby, we moved closer to home to be near the grandparents. And so now I'm working in Regina. I have obtained myself specialized education in pelvic floor physiotherapy. So I do work with new moms, people who've had pelvic surgeries, people who have pain or other issues with their pelvis. But I also work in orthopedics, where I treat people who have shoulder injuries, knee injuries, and back injuries, and all sorts of things like that. So I like the mixture that brings into my day of treating different types of people, different types of conditions. And I really enjoy that. So I work in private practice, and I am an independent contractor here. And so when I don't work, I don't make money. And when I do, I do. And so that's kind of where I'm at right now. So rewards and challenges. So the best thing about being a physio, like I said, you can work anywhere and in so many different settings. That's really cool. If one day I'm like, nah, I don't want to work in this private clinic anymore. I want to work I want to work with people who have spinal cord injuries. I can switch, and I would of course get some more education just to refresh, and that would be offered in-house as well. And I can go and I can work with people in a rehabilitation center who have spinal cord injuries or brain injuries. Or I can switch over to working with children, or I can work in long-term care with seniors. And you can really make an entire career of one type, or switch and work in different settings. And so that's really cool that you have lots of options. And working with people is great. If you're someone who doesn't like to sit still, just like me, then being a physio is great because you're not really sitting very much. You're on your feet, you're working with people, and the computer work is minimal. And I also really like the problem solving about being a physiotherapist. So you might think that this person with a shoulder injury is the same as all these people with shoulder injuries, but they all bring different stories and different personalities to the table. And so really solving, taking that person in as a whole and solving and helping them solve their issues is really rewarding as well. And it keeps me active, it keeps me moving, and I get my 10,000 steps in every day. And so I really appreciate that too. Some challenges. Yeah, sometimes it can be stressful. During the pandemic, there's certainly, we're just under more stress, right? So you're working with people, and so you're always trying to navigate people's emotions and things right now too. And while it's very rewarding to help people in these times, it's also can be very taxing sometimes. I used to come home from work and just talk about my day with my husband, and he would talk, and we talk about it, but now we like never talk. We never talk physiotherapy when we get home. We got kids, we got other things, we just talk about that stuff. So sometimes it's hard on us, on ourselves physically too, on our hands and stuff, and our bodies. Yeah, but at the same time, we continue doing it because it's so rewarding to help people when they're having issues and they're coming to you for help. So yeah, those are kind of the biggest challenges, I would guess. Yeah, so that's me. And I guess that's everything. I think there's 5 minutes left for questions maybe, or I don't know, did I go long enough, or how am I doing here, Gord?
That was awesome, Dina. You covered everything very, very well for the kids. We have a couple of questions here for you.
Sure.
I was just wondering, how many patients a day would you roughly have?
How many patients?
Yeah, how many would you see a day, in a typical day for you?
Yeah, so I think at the moment I see about 11 or 12. We in our clinic we do assessments and treatments, and the assessments are an hour and the treatments are 30 minutes. But there are some clinics who who do 20-minute treatments, or even 15-minute treatments. That's not as common in Saskatchewan, but so then those people might potentially see more. But myself, I see about 10, 11, 12 patients per day. Yeah. In a hospital, you might only see, depending on what you're working with them for, you might only see 4 or 5 because the rehabilitation session takes maybe an hour with that particular person. So it just depends what setting you're working in.
And in a typical day, a common day, what percentage of an area would you see? For example, pelvic floor versus, I don't know, something different. Like, what would you say your breakdown is of what kind of things you do in one day in the areas that you concentrate on?
Yeah. I don't know, maybe 50% of pelvic floor and 50% sort of general orthopedics. So that's treating the shoulders and knees and all those other things. Yeah, it varies, and it varies at the time of year sometimes too. Yeah, but my orthopedic clientele also includes clients who are coming here with a work injury, so WCB clients, or who've been in car accidents, so SGI clients. Yeah, and then just people who've injured themselves playing sports, or who have stiff back from sitting all day, or all sorts of different people. But probably right now, maybe 50-50, somewhere around there. Yeah, it's a good mixture for me because I like having a little bit of both. So yeah.
Dina, I like that you really showed through your credentials and your qualifications that you're constantly learning. You're never going to stop. For kids who are thinking about going into this, you started out with a kinesiology degree. Is that common, or can you do a science degree too? What are the options there?
Yeah, kinesiology is probably the most common because it's similar, right? You get into that learning about the human body and exercise and well-being, fitness, things like that. So probably most students who go into physiotherapy have a kinesiology degree. But there's a varied background, and it's kind of good actually. I know there were 2 people in the class ahead of me who had political science degrees, and but otherwise the right courses required. And they actually ended up going on to work with the professional association in Alberta, where we went to school. And so they had some advocacy and lobbying to the government kind of education and experience. So it was actually really good to have people with those varied degrees for those different avenues. Or you might have someone who has a science background who ends up going into research, or yeah, so probably the most common degree is and it's kinesiology, and it's maybe the most relevant, like maybe the best if you want to sort of get a leg up going into physiotherapy, but certainly it's not required.
Okay. And that's a 4-year degree, and then to get your physiotherapist degree, how many more years?
Another just over 2 years. So the whole education is just over 6 years. Yeah. In total. Yeah.
Okay. I think that's it. I want to thank you very much, Dina, for coming on, and you covered everything very, very well. Again, I want to emphasize to the students who watch this, please take the time to fill out the survey, which can be found at www.rdiec.ca, and that enters you for a chance to win a $50 gift certificate. This has been incredibly insightful, and I want to thank you on behalf of the RDIC for stepping forward and providing this for students. It's going to make a big difference.
Good. Thanks for having me. It was fun.